What is the Republican stance on healthcare deregulation? Imagine a healthcare system where the government steps back and lets the market take the lead. That's the core idea behind what the Republican Party advocates when it comes to healthcare deregulation. They believe that less government involvement means more choices for consumers, lower costs, and more innovation. Their current platform emphasizes rolling back many rules from the Affordable Care Act, which they see as limiting options and driving up prices. Republicans want to repeal or significantly change the Affordable Care Act, removing mandates like coverage for pre-existing conditions and essential health benefits. They argue these rules make insurance more expensive and restrict what plans can offer. Instead, they support insurance plans with fewer federal restrictions, giving consumers more flexibility. They also push for shifting Medicare toward private options like Medicare Advantage, which combines traditional Medicare with private insurance plans. The goal is to give seniors more choices and encourage competition. For Medicaid, they favor block grants to states, allowing them to decide how to spend federal funds. This approach aims to give states more control but might mean fewer services for some low-income people. A big part of their strategy is promoting health savings accounts. These are tax-advantaged accounts that people can use to pay for medical expenses. Republicans believe that encouraging people to save and spend their own money makes them more responsible and helps control overall healthcare costs. They also support high-deductible health plans paired with these accounts, which tend to have lower premiums but higher out-of-pocket costs. On the spending side, Republicans aim to cut federal healthcare costs by more than $1 trillion. They believe reducing government spending will help make healthcare more affordable, but it could also mean fewer protections and coverage for some Americans. Overall, the Republican approach to deregulation is about giving more power to individuals and states, reducing federal rules, and fostering competition. They argue that this will lead to a more efficient, innovative, and affordable healthcare system. However, they acknowledge that these changes might reduce coverage for some, especially low-income populations, and eliminate some protections put in place by the Affordable Care Act. Their goal remains to create a system where patients have more choices, and the government plays a smaller role.